At University of Virginia Health System, we're for bringing advanced care closer to home. So we're bringing health knowledge directly to you with UVA Health System Radio. Here's Melanie Cole.
What is pulmonary hypertension and how is it linked to heart failure? My guest today is Dr. Sula Mazimba. He's board certified in internal medicine and cardiovascular disease, and he specializes in caring for patients with pulmonary hypertension and heart failure. Welcome to the show, Dr. Mazimba. So tell us a little bit about pulmonary hypertension. What is it, and how does it differ from hypertension that we might have heard about?
Thank you so much for having me on the show. Pulmonary hypertension is a type of blood pressure that affects the arteries in the lungs and ultimately the right side of the heart. In order to be able to sort of understand the disease, it's important to understand that there are two sides of the heart, the circulation. There is the left side and the right side. And in order for blood to pump around the body, it has to pump from the left side, which has a higher pressure, to the rest of the body and ultimately to the right side, which takes blood to the lungs. So the right side of the heart has fairly low pressures. It's a low pressure system. And in some situations where you start having elevation in blood pressure in the right side of the heart or the lungs, what happens is that the circulation is impaired, meaning that the blood going to the lungs is not able to adequately get oxygenated, and so it affects the circulation around the heart. And that's kind of, in a nutshell, what pulmonary hypertension really is.
So what symptoms might somebody experience if they think that they might have this?
The symptoms for pulmonary hypertension are actually very non-specific, and because of this, sometimes patients present very late. So typical symptoms include shortness of breath, which, as you know, is very non-specific. Patients really just feel short of breath and very tired, dizzy. Occasionally they may have some chest pains or racing heart, and so they tend to be very non-specific.
Okay, so what would send somebody in to see you to even get tested for pulmonary hypertension? Would it have anything to do with if they have been suffering from regular hypertension before, or if they have a family history of this situation?
In some cases, patients do have history of family history of pulmonary hypertension, and sometimes they come testing for the disease. But those are very few situations. Oftentimes, patients would have presented at their primary care physician. They may have been trying to find out why they are very short of breath and very tired, and ultimately an echocardiogram is ordered, and that kind of shows that the pressures on the right side of the heart are high, and that's how they end up oftentimes coming to see us.
If you diagnose someone with pulmonary hypertension, then what do you do for them?
Well, in some cases, pulmonary hypertension is related to other disease conditions, and so when we are treating pulmonary hypertension, we often treat also the underlying disease condition. But the treatments are often very complex. The medications that are there are sometimes very complex, and so we oftentimes have to make combination therapies, and there are also what we call supportive therapies, where we essentially not necessarily altering the disease process, but we are kind of helping patients deal with their symptoms, like, for instance, giving them some diuretics, oxygen, blood thinners. In some situations, we resort to surgery. We may oftentimes recommend lung transplant or heart and lung transplant, depending on the situation.
So what are some of the complications that, could happen if they can go into heart failure if this isn't treated? How long can it go on before those complications might start to set in?
That's a very good question. So pulmonary hypertension is, like I said, is associated with other disease conditions, and so it depends on the company it keeps. There are some situations where, for instance, it may be connected with rheumatoid arthritis or other connective tissue disease. And so depending on the company it keeps, the prognosis also varies according to the type of pulmonary hypertension. There are various types. We often categorize pulmonary hypertension in five major groups. And so each of those groups may have different prognostic type over the long haul. But in general, without treatment, pulmonary hypertension can be very fatal. And so this is why it's critically important for patients to present early so that we can institute some of these medical advances, including therapy, treatments, and sometimes surgeries.
So, Dr. Mazimba, how does your expertise in hypertension relate to your work with heart failure patients?
So, as you know, when pulmonary hypertension is severe enough, it impairs the contractility of the right ventricle, meaning that the right ventricle will have to struggle to push blood to the lungs. And so ultimately, heart failure is the leading cause of death in patients with severe pulmonary hypertension. And so there is that link between pulmonary hypertension and advanced heart failure.
Wow, it's really very interesting. So tell the listeners, why should someone come to UVA for heart failure and pulmonary hypertension care, and give your best advice for people that might be suffering some of these nonspecific symptoms, and what you would tell them?
So one of the reasons why patients should really look at UVA as a place where they need to seek their care is that pulmonary hypertension and heart failure are very complex disease conditions, especially heart failure when it's advanced. And so they are best served in medical teams that specialize in these disorders. And at UVA, we see patients from within the state and outside the state. And so we have a lot of experience when we talking about pulmonary hypertension and advanced heart failure. And so that is one of the strong points. The advantages of care at UVA is it's multidisciplinary, and we see a lot of patients, very complex patients. One of the things I would advise patients who are having these nonspecific symptoms is, of course, talk to your doctor about this, and don't blow away the symptoms and say, well, it's maybe because I'm just tired. Indeed, you may be tired, but if the symptoms persist, it's important to seek medical advice.
That's very good information. You're listening to UVA Health Systems Radio. And for more information, you can go to uvahealth.com. That's uvahealth.com. This is Melanie Cole. Thanks so much for listening.